Thank you. Okay, I have about 3 hours worth of talk here. Okay, so I hope everybody got your lunch. Okay, everybody get to eat, and we'll have a bathroom break in the middle sometime with a couple of breaks. Thank you for inviting me. Thank you for coming today. I'm tickled to death. Hi, Susie. I'm tickled to death to be here. This is a subject that just thrills me. I enjoy the history of Arkansas, but especially I enjoy the history of healthcare, health and disease in Arkansas. When the place we call Arkansas was purchased from the French, there really weren't many people here. There wasn't any public. There were about 4,000, maybe 5,000 people, depending on how you count the indigenous people of the state. There were probably 2,000 to 3,000 indigenous folks. There were about 400 white European settlers, primarily French and Spanish. Most of those people were hunters, trappers, and a few farmers, and 65 slaves. By the Civil War, by the beginning of the Civil War, there were 436,000 people in the state of Arkansas and 111,000 slaves. But for the first 20 years, nothing happened, okay? And the reason nothing happened is because uncertain land claims from French and Spanish and Indian claims. But part of it was this barrier that is the swamp, that are the swamps of East Arkansas, that was the Delta, that is the Delta, okay? And the other thing that kept people from coming here were the diseases and the swamps. This was a very harsh place. This was, back in those days, the terms salubrious and insalubrious were commonly used. Salubrious means healthy, and you can guess about insalubrious. Arkansas, with the exception of Hot Springs, was declared insalubrious most of the time. And it was hard on the men, it was hard on the women, it was hard on the children. And part of the harshness had to do with fevers. And remember, in those days, they didn't talk so much about specific diseases as much as they did broad categories of how these things presented. The fevers that they talked about in those days, the things that were endemic in the Delta, were about 3 forms of malaria and typhoid fever. Okay, so there were about 4 illnesses. But everybody who came here got them, okay? And if you survived for a year or so, you were considered seasonings. Now, we had a few Superior Court territorial judges who came to Arkansas Post over on the Arkansas River, got off the boat, on the Mississippi River, got off the boat, got back on the next boat out, and said, I ain't going back, okay? Primarily because of the mosquitoes and the swamps, okay, and the disease. Now, what people did, instead of coming across the swamps, they came down an old trail that started in St. Louis and went to Mexico, okay? That trail is what we call, you can't call the Old Southwest Trail. It had been an animal trace, and then there was an Indian footpath, and then it became the primary route that people came into Arkansas. They came to Hicks Ferry, that's spelled wrong, by the way. It should be H-I-X, not H-I-C-K. They came to Plum Bayou, okay? Plum Bayou is what ended up being Batesville. They came to Searcy on the Red River. They came to Cadron and then Little Rock on the Arkansas River. Then they went through Saline Crossing on the Saline River, which a few years later moved up the out of the river bottoms to become Benton, and then it went on down and into Mexico at Fulton, or close to there. Every place that they crossed the river, okay, they would put a way station, and it was usually a grist mill, a post office, a place where people could stay either in or outside of it, and a place where you could get supplies if supplies were available, okay? Now, 95% of the people in Arkansas, as in most agricultural societies around the world, lived in the country. They didn't live at the way station. But when one or more people gathered, a doctor showed up, okay? Guaranteed, okay? Guaranteed, doctor. And doctors showed up, okay? And these guys, most were not very well trained. A few were, but most were not very well trained. Most of them would either do an apprenticeship with another physician, and then over a period of time they would put out their shingle, or they just put out their own shingle. And they wouldn't, because there weren't any laws that controlled it. These were in the Trans-Mississippi, as they call it. One university-trained physician who probably became the father of medicine in Arkansas, medicine in the modern era, was a fellow named Matthew Cunningham. And Dr. Cunningham came to Arkansas and settled in Little Rock about 1819, before it was actually a town. He's probably the very first European person to call this place home. There was a military shack, but that was about all. And this was a place where he came to and he went out from, okay? A year or so later, he brought his wife, and they set up, he became the mayor of Little Rock. He became the first coroner of Little Rock. He became the first one to pass an ordinance once it had the pretensions of being a city. He passed an ordinance, the first public health ordinance, to get dead animals off the streets of Little Rock, okay? All right. And you're sitting pretty close to right on top of, by the way, a thing that became a really important point for Matthew Cunningham and all the other people. The town branch runs pretty close to here, and it was a little creek that started over there close to where the Mount Holly Cemetery is, or maybe this way, and made a circle this way and went down towards Fouche, okay? Well, it was just open sewer. It was just an open sewer. Everybody dumped everything into it, and then they went over the river and got their water. By the way, the taste test, clean water in the 19th century was if it looked clean, if it smelled clean, and it tasted fresh, it was clean. Well, you can see the problem with that. 1820, sometimes I get these mixed up. 1820 saw a really important advance. There would be another one in the 1870s, but steamboats started bringing people in. They brought large numbers of people in, and the population started to grow dramatically. It was doubling every 10 years after 1820. And with it, it brought disease, okay? There were 3 violent diseases that got superimposed on top of the fevers of all the other things, and all the things that we normally think of as disease now. They were smallpox, cholera, and yellow fever. Understand, these people, the prevalent theories there were 2 prevalent theories about health and disease back at that time. One said that for all of these things to happen, there had to be an epidemic constitution. There had to be the right temperature, the right humidity, the right amount of decaying organic material in the community before these disease outbreaks would take place. And then there was this other group of people who said, no, these are just contagious. There's something contagious. Well, and that was the argument that went on primarily among the doctors, okay? Most people, when they saw an outbreak of anything, whether it was a fever or whatever, they ran, okay? They had good, ordinary, common sense. They knew it was contagious. Despite being told that it wasn't a problem, they just ran, okay? So when we start talking about this, the germ theory, the whole idea of the germ theory did not actually take hold in Arkansas until the very late part of the 19th century and the early part of the 20th century. The first of these 3 violent diseases to strike the population, and it had been around forever, it wasn't a new disease, but it scared people to death, okay, was smallpox. It would come through, it would hit large groups of people, and it was clearly contagious. And there was one case in 1826. The first case, a documented case of smallpox in 1826, was a black man got off of a steamboat, came into town. Within a day or so, it was obvious he had smallpox. The city fathers, and they're a little nondescript about this, the city fathers sequestered him, okay? And he died in a day or two. Within a few days, okay, the Better Business Bureau, I'm not sure what they were called, took over. This wasn't really smallpox. We don't have smallpox in Little Rock, okay? and they would have swayed the day, except smallpox started breaking out in other places around, so then they lost this particular battle. The second of these violent diseases that was a real problem took place during the ethnic cleansing of the 1830s, okay? Now, we don't normally say ethnic cleansing, we say Indian removal. But Andrew Jackson decided he was going to move all of the Indians that were east of the Mississippi, west of the Mississippi, okay? And cholera. Cholera made its introduction into the United States through Canada in the spring of 1832. And by the fall, it had come down the East Coast, coming up the Mississippi, okay? The group of Choctaw Indians, and I'm going to spend just a little bit of time here, but the Choctaw Indians from Mississippi were being moved across Arkansas, and that's actually where the name Trail of Tears came from. This was the second group of removals. They were at a town called Rock Row on the White River. And Rock Row is where Clarendon is right now. Cholera broke out. The very first public health, the first change in the social contract, that it became important for us to deal with the public's health, happened at that time frame in the city of Little Rock. Matthew Cunningham was the mayor. They did the very first public health investigation. They sent a doctor and his minions over to Rock Row. They created the very first hospital designed to take care of people with cholera. Again, more quarantine measure than anything else. And they created the very first temporary board of health, okay? And that would resonate for the next 100 years or so. Slavery, you can't talk about the public's health in Arkansas without talking about slavery. You can't think about it. You can't think about it then. You can't think about it today, because many of the policies and thoughts and ideas and things that went on back then still have an impact on us and are still being played out in our political discussions today, even though we don't call it slavery anymore. You understand that during the slavery time, slaves were valuable pieces of property. There's a note about a woman named Sevilla, who was a female, a young black female who was capable of having children. She had scrofula, and scrofula is where you get tuberculosis of the lung. Tuberculosis comes through nodes in the neck, and the nodes break open and suppurate. And so, as opposed to being worth $1,200, she was worth $500. Okay? Very often, the black slaves got just as good a care as the whites did because they were valuable property. The Civil War, this is old, this is hoary old stuff. We were talking about this last week. This is a hoary old story, but there were far more people killed during Civil War because of disease, because of infected wounds, than by actual gunshot, just far more. And when the slaves were emancipated in 1863, they set up freedmen bureaus and freedmen hospitals, and they became places where they were just pit holes. They were terrible. That was finally abandoned in 1867. Cholera, smallpox. Helena was called by the federal troops Hell on the River, because at one point the federal troops who were stationed there, they could muster less than about a tenth of their people for any one day, okay, because of illness and disease. Mosquitoes and disease, that's right. Slavery was replaced by Jim Crow and peonage. By the way, if you want a good example, if I can find it, I should have it out already. Well, I've got it somewhere because Cindy gave it to me. If you want to know how peonage works, okay? If you own the means of production, if you own the land, the means of production, you own the store, if you pay the people who are working on your land with coins that you've coined, that you've done, bronzine coins, then you can set the price of that coinage, okay? You can raise it or lower it based on whether you get a raise or lower in the price of cotton. That's where peonage came from. And peonage was a real problem because now that these people who were no longer slaves, they did not have health care. The germ theory. Germ theory is extremely important, as you all know, but most people don't realize that the germ theory didn't come around until about 1850, 1860. It had been around for 200 years, but nobody accepted it. By 1865, it had been discovered. Okay, now I don't know if you know about the information float time. Okay, in the internet stage and Facebook and all these kinds of things, the information float time is about -6 days. So that if a family doctor is in his office seeing patients, a patient's liable to come into his office and say, "Did you know that there's this new cure for this kind of cancer?" Okay, well, in the information float time between when something is discovered, something is validated, something is disseminated, and then accepted. That's what the information flow time is. In those days, it was in terms of decades, okay? It was not in terms of weeks, months, years. So it took a generation or two of physicians to die off before the germ theory would start being accepted. The railroads brought people. They brought massive numbers of people. They brought the Catholics. Okay, that's my wife's family. They brought the Catholics to the Arkansas River Valley. They brought large numbers of these people, and there were a lot of other things that happened. Yellow fever. Yellow fever was a big deal in the 1870s. There was a lot going on, but in terms of disease, yellow fever was a big deal. It had been in the Mississippi Valley, but not reported in Arkansas. It had been here since the 1820s. Okay, but the first epidemic of yellow fever was in 1855 in Helena, just before the federal troops got there. And there was one in 1872, 1878, and 1879. The city of Memphis was what do you call it when you disenfranchise a city? You're not disenfranchise a city. What do you call it, Sam? When you decommission a city. They just decommissioned the city. So many people died in those time frames, okay? There were so many people died. And in the second round, in the 1878 range, there were a lot of people who got it across the river, okay? Who got yellow fever. And then it hit Forest City, coming across Crowley's Ridge. And then it got up to Augusta. It did not get to Little Rock significantly. The late 19th century saw an era of professionalism happening across the country. The American Medical Association formed in 1847. The Arkansas Medical Society formed in the 1870s. The Arkansas Bar Association formed in about 1890 or somewhere around in that range. The pharmacist organized, the dentist organized. Ultimately, in the beginning of the 20th century, the nurses started organizing. Now, I'm going to talk about the medical profession here for just a few minutes as we go forward on this. We often think of the medical profession as a big, homogeneous group of people, monolithic group of people. They're not, okay? There's always been a group of people within the medical profession, a large group, the vast majority, who look on the Arkansas Medical Society and the AMA as a trade union. And that's what they are. They're a trade union, okay? But there's also an elite group of people like Tom Bruce, okay? Sitting in the back, okay? Like Tom Bruce and Joe Bates, okay? And Morgan Smith and all of these people. There's an elite group of people whose primary interest is to use those to upgrade the training, to upgrade the abilities of the people who work as physicians, okay? The late 1880s, there was another temporary board of health was formed, a national board of health, state board of health was formed, the first state board of health was formed in that time frame. Tuberculosis was one of those diseases that was described as consumption or scrofula. It was a bad cold gone, it was a cold gone bad, something you let linger for a long period of time, and you were in the wrong epidemic constitution. But Pasteur and Lister discovered the germs. Then Koch in the 80s started identifying, Adolph Koch and his students started identifying the particular bugs. And by the beginning of the 20th century, 1808 or 1908, 1909, we began to see the importance of tuberculosis, and it was the #1 killer in the state. It was beginning to drop off a little bit in certain areas of the country, but it was #1 killer in the state. I put one thing on here that I want you to look at. This is the very first Christmas seal. Okay, Christmas seals were originally developed to fight tuberculosis. That's what they were for. This was in 1907, 1908, and there was a dear lady in Hot Springs the following year who happened to be a member of the Arkansas Federation of Women's Clubs. My hat goes off to these women. If you don't know about them, you need to rush to your library as quickly as you can and read everything you can about them. They are wonderful. They've done more things for the state of Arkansas than any doctor or group of doctors, any nurse or group of nurse anywhere. In the early 20th century, they started 81 libraries. They created traveling libraries. They lobbied for every public health issue, every particularly related to maternal and infant care, because we had this horrible maternal and infant mortality. Okay, and these women were just wonderful. Well, there was a lady in Hot Springs who got word of this. She started a movement in Hot Springs to get the very first Christmas seal program in Arkansas. Now, I'm not putting a whole bunch of people in here, but I got these 4 people up here because these 4 people shaped the public health of Arkansas for the first half of the 20th century. This is the Tom Rooster set. Okay, it's Morgan Smith. Okay, he was dean of the medical school. He pushed for the board of health, the initial board of health. He knew how. He was a wonderful politician. He knew how to politically motivate people to do things, and he pushed for the sanatorium, for the TB sanatorium and the development sanatorium. He was just a wonderful man. This lady right here is Vinnie Middleton. And I'll tell you the rest of her name in a minute. Vinnie was a graduate of St. John's Nursing School in Fort Smith. She came to Arkansas, became the nurse matron at the Logan Roots Hospital, which is where the medical school was associated with at that point. Not Fort Roots, it was a little small hospital here in Little Rock. And she was also a member of the Arkansas Federation of Women's Clubs, okay? She was also a very big in their public welfare section, okay? And so anytime something needed to happen, then Morgan Smith would go to Vinnie Middleton, okay? And they'd start a petition drive. Okay? And so all of these women who didn't have a vote, okay? They didn't have a vote, remember that, okay? But their husbands did. And most of their husbands were legislators, doctors, or businessmen. They were extremely, extremely powerful. This lady also, she's just a wonderful character. Nobody knows about it. This fellow right here is CW Garrison. CW Garrison is the father of public health in Arkansas. He was a barn burner, okay? He was imprudent in his speech, okay? He said things that people didn't want to hear, okay? And he was a protege to Morgan Smith, okay? Morgan Smith, when they passed the temporary board of health, or the permanent board of health, he became the head of the board of health for a very short period of time, realized he couldn't do that and be the dean at the same time, so he went back to being the dean, appointed somebody else who was there for a short period of time, and then for the next 20 years, C.W. Garrison was the guy. Well, it's kind of interesting. This is never written down anywhere, and I'm supposing this because it really looks like it. He called spade regularly, okay? He said, this is wrong, this shouldn't be done this way, we need to have this, we need to have good water, we need to have clean sewers, or clean water, we need to have good sewers. And he made people mad everywhere he went. But as long as Morgan Smith was head of the medical school, nobody could touch C.W. Garrison. So C.W. Garrison built a pretty strong health department. By the way, they didn't call it the health department then. It was just the Board of Health with certain departments under it. Hookworm. 80% of the people in Hot Spring and Garland and Grant County had hookworms in their stools, okay? People of Arkansas didn't want to hear that. 20% of the entire state did, but 80% in those counties. Now, the treatment for hookworm is purging and all this stuff. We're not going to talk about that. But the real treatment is don't get the damn thing, okay? And the way you don't get it is you have a scientific privy, okay, that doesn't drain into your water supply and give you typhoid as well, and you wear shoes. Well, the Arkansas legislature, part of the Arkansas legislature thought that this whole thing was a plot by the Brown Shoe Company in St. Louis to sell shoes. And Dr. Garrison and Dr. Smith had to really fight that issue because the doctors didn't know anything about it. Malaria was the next big issue. By the way, this was not solved. The Rockefeller project that occurred in the teens did not solve the problem of hookworms. Solving the problem of hookworms happened when they had good sewage and when they started wearing shoes. Malaria control. Malaria is a big deal, big problem for Arkansas. And there were two main projects. There were two main projects, one in Lake Village and one in Crossett, in 1917 time frame, where they demonstrated that for $1.50 a person, okay, you could reduce the incidence of malaria in a community by 90% in 1 year. Nobody ever did anything about it until the end of World War II because it was too much money. Okay. Camp Pike, Camp Robinson, okay, was really important to infrastructure. I really don't have time to go into that, but there was a physician named Geiger who was the public health service doctor over there, and he and CW Garrison again. CW Garrison went over there and said, now guys, we really need to expand your cantonment area, the area around a military camp, to include all of Pulaski County, parts of Lonoke County, parts of Prairie County, and they did. And when they did, they started creating all this infrastructure for scientific privies, for restaurant inspection, for hotel inspection, for VD control. And between Geiger and Garrison, they created the infrastructure for public health in Arkansas. Right in the middle of all of this, the flu hit, the Spanish flu. You know why it's called Spanish flu? It's called Spanish flu because they were the only ones who weren't combatants, and they were the only ones who would publish their statistics. 7,000 people died in Arkansas in a 4 to 5 month period from the flu. That was 3 times as many people as died in the from the war injuries. Okay. By the way, the only place that didn't get the flu in 1918 in Arkansas, in 1919, was Booneville, because they quarantined all of their staff members, all of their patients. They quarantined everybody. They couldn't leave, okay? And so until it was over, everybody just stayed there, okay? And they didn't get the flu. Probably the most significant unsung hero in Arkansas public health, is Zach Fair. When he came to Arkansas in 1919, he described the water systems and the sewer systems in Arkansas as absolutely atrocious. Okay, got it. Oh, back up here. Okay, as absolutely atrocious. Okay, and over a 20-year period during which he and CW Garrison backed him up, whereas Morgan Smith backed him up. These two men created clean water in Arkansas. They created good sewer systems in Arkansas. I've got some cute stories about him because he was not very politic either. Lenny Beauchamp, this is the other lady from up there. She started public health nursing in Arkansas. She's a Red Cross nurse. Red Cross nursing really had its hands all over Red Cross, and Red Cross nursing had its hands all over public health in Arkansas and have since about 1912. 1912 was the first time we can document that Red Cross sent nursing staff into Arkansas. There were floods very similar to the one we had here in 2011. But she's a wonderful lady. By the way, she and Vinnie Middleton Garrison, okay? They were back there, right? Okay. In 1950, during polio, she helped instruct, she was retired by that time, she helped instruct all the young nurses on how to take care of crippled polio children. Okay? In 1958, when, what's the lady's name who did the Keep Our Schools Open? And Terry, Miss Terry? Adolphine Terry. When Miss Terry put together her list, and they had the list of signatures, Lenny Beauchamp and Benny Middleton were on that list. Okay? Arkansas Federation of Women's Clubs. Okay, okay. If you don't know about them, you need to learn about them or join one of them. The children, and another one of their issues was the Children's Bureau. Is the burden of all of this injury and illness was on the children, more so than the adults, and it was on pregnant mothers because infections were still high, and so Lenny Beauchamp brought Margaret Sage, I can't figure it out. Margaret Sage Bradley, a really powerful woman, into Arkansas. She got up and talked to the Arkansas legislature and convinced them to donate, to put $5,000 into starting a children's bureau in Arkansas. Okay. She didn't stay very long because she fought with Garrison, but that was okay too. That was okay. She did a lot of good while she was here, and she got some things started. The flood of 1927, really very important, in that it displaced almost 200,000 people, okay, in the state of Arkansas from their homes. It wiped out their potential to have a garden. It wiped out their potential. It wiped out their potential for anything. And these people were on the process of getting ready to start starving. The Red Cross and the federal government came back in and created evacuee camps, refugees camps. This one is the one at Fort City. Had 15,000 people. Everybody there had to be immunized. Everybody there got fed, and everybody there got yeast. Not yeast infections. Everybody got yeast, okay? Because it helps to create, it contains niacin, a lot of niacin, okay? And pellagra almost disappeared, okay? The disease pellagra is caused by a lack of niacin, and it was almost, so it's really very interesting. A lady named Lavender did some really wonderful work on this. 1931 produced another really serious problem, and that was drought and starvation. Now, we don't think about this because we live in this wonderful state that Harry Ashmore called the boundaries of Great Game Reserve. But when all the lakes and rivers and streams dried up, the animals had to go out into the open to get water. They were killed off. So they killed off the bear, they killed off the deer, they killed off the coon, they killed off the rabbit, they killed off the squirrels, they killed off all the animals, and it wasn't until the Game and Fish Commission revved up right after World War II that we started seeing a resurgence of all of that. But this also knocked out the home gardens. It knocked out everything. The landowners, especially in East Arkansas, fought any aid as hard as they possibly could, especially aid to black farmers, because their thought was, if you feed them, they won't stay on the farm. They won't go back and work, okay? CW Garrison, I don't say anymore, CW Garrison got in there and started lobbying and lobbying and lobbying. I did not find a reference to the Arkansas Federation of Women's Clubs in this, but their handprints are all over this. And it didn't take long before they were able to get Red Cross aid in, massive Red Cross aid in, and the starvation that would have happened didn't happen. There was another change in the social contract in the 30s with President Roosevelt. I don't have time to talk about that today, but it was really important to the state. They put a lot of money in public health in. The real unsung heroes for public health are these guys, okay? They are the public health nurses. They're wonderful. It's a whole different talk, okay? Medicine and expense, okay? How much time do I have? Y'all tell me. Okay, good. All right. Prior to the 1920s, health care was cheap, okay? Healthcare was cheap because there wasn't anything they could do, all right? There wasn't anything they could do. It was cheap. If you consider it modern, in the 1920s, you had okay? Then came insulin in 1922. Diabetes was just a death sentence, okay? If you didn't have it. And after insulin, that not true. Then sulfur, and then penicillin, okay? These changed things. Also, the other thing that changed things were EKGs and X-rays. Changed things dramatically. So health insurance came into being, okay? The medical society fought it tooth and nail. They hated the idea of health insurance, okay? But in 1946, they saw the handwriting on the wall. The Arkansas Medical Society, the Farm Bureau, and the Arkansas Hospital Association created Blue Cross and Blue Shield in Arkansas, okay? All right. It had been started in Dallas in 1929. The infrastructure for healthcare facilities in Arkansas started in the 1940s with Hilburton hospitals. Every little town has got a hospital. Every little town's got a nursing home. Every town's got it like this, and it's very important. Polio hit, big deal, killed a lot of people. Salt and probably one of the biggest national thrusts was done involving Salk and Sabine vaccines, and it saved many, many lives. But in 1959, the then chairman or head of the health department said, we don't have any money for vaccine for the underserved, period. And he was just stating a fact. There are some people who form a constituency all in their own, okay? Betty Butler was a constituency all in her own. She didn't have the resources of the National Guard, but her husband did, okay? Okay? She had the resources of the Arkansas Federation of Women's Clubs. She had the Arkansas Nurses Association, okay? Okay? She had all of these people. And then ultimately, Rosalind Carter, when she went to Washington, they did a statewide program and then they did a national program that did more good, okay, for children, okay, than just about anything that has been done. 1965, the social contract changed again, and underserved people started getting care because they could. Arkansas took about 7 years to buy into this, and if it wasn't for Roger Bose, it may have been 25 years. And I wish Roger Bose was around today. Mental health, very interesting. Mental health, the old insane asylum, essentially went away, but everything was atrocious by the 60s. By the 60s, there was a move to try to get people out of big institutions and into community mental health. And so we have 12 catchment areas. And we have a few programs like Birch Street Community. And I'm very proud of, a friend of mine started Birch Street Community. I'm very proud of it because it's an organization based on the humane care of the mentally ill and getting them in the least confined circumstances where you can get them. And it is public health at its best. Smoking, okay? Big issue. Guess who was behind the Arkansas Heart Association, the Arkansas Lung Association, and the Arkansas Cancer Society? You got it, okay? That group of women. I mean, they were out there at every turn. You can see their fingerprint over all of these things. And then you have some really enlightened physicians like Dr. Joe Bates, who pushes and pushes and pushes and pushes politicians who might not ordinarily do it to pass things like the Arkansas Clean Air Act. And also make sure that the tobacco money goes to health-related issues and not to roads and prisons. Okay? And that's Joe Bates. Okay? So if you meet him on the street, if you know him, obesity. This is one of those issues where there is a fairly significant thing going on right now. There was a report in the New York Times about 2 weeks ago that showed that infant obesity is beginning to, young childhood obesity is beginning to be reduced. That's very important. And that's because of some really good programs from CDC, from Healthy Arkansas, from Healthy America, or Healthy, anyway, so that it's a bad issue, serious issue. We all grew up around storm shelters, sirens, okay? Arkansas is particularly sensitive to these areas because you can't see what's coming a lot of the times. But we have a wonderful emergency services. Eisenhower warned us about the military-industrial complex. He did not warn us about the medical-pharmaceutical complex, okay? But it's the same thing, all right? I have a friend who sells medical equipment who told me, he said, if you give me something with whistles, bells, and lights, I can sell it to a doctor, okay? And that's true. I was in practice for 40 years. That's where our drug program, that's where our drug problem, our prescription drug problem came from. Not where it came from, maybe where methamphetamines came from, because when methamphetamines first became available, John Wright, one of my friends, he would get them in the mail. He would get bennies in the mail, okay, to sample. We used them for diet pills. I didn't. The medical profession used them for diet pills, and they were being pushed by the drug companies to do so. The Mayflower oil spill. Human waste goes away. Petroleum-based waste doesn't. We have to find things to do about that. Okay, I hope I got a couple more minutes because I want to tell you about a really important person, okay? If you don't know Steve Collier, you need to have him here to speak. Steve Collier is from Augusta, Arkansas. That's where I'm from. He was called back to Augusta in the mid-'70s and told, we don't have a doctor. We built a clinic. The county judge, who was my cousin, the county judge and several businessmen said, we built a clinic. We want you to come back here and help us make it work. We'll find ways to help get it funded. He did. And our care, what his clinic ultimately became White River Rural Health, and that ultimately became our care. They now provide services in 27 counties. Count them. 18 full-time equivalent physicians, 27 APNs, an association with the pharmacy school that's developing at Harding, okay? These people are providing care in rural areas where nobody else can, nobody else will, okay? And they need to get recognized because this is the model. So where are we going from here, okay? Y'all are going back to work. I'm going home. I'm retired, okay? Where are we going from here? Nobody really knows, and it really does depend on you ask. If you ask Bill Mason at the health department, what's going to be our big problem for the 21st century? He'll say, what happens when the oil mains that cross the Mississippi River, we have an earthquake like the New Bradford, which we're going to have one of these days, and it ruptures and contaminates the entire river, okay? What happens when we have a vortex that doesn't come and stay a day or so, it comes and stays for a month or so, okay? What happens, you know, Rene DeBose wrote about the fact that that live tissue adapts, okay? Bacterias, virus adapts. We now have a situation where somebody can get something in Wonju, South Korea, get on an airplane, and be in Benton, Arkansas in 24 hours and not even know they're sick, okay? Those things are going to happen. Now, my feeling is we got some really good people in place. We really do have. For once in our life, we have some really good people in place. Some people who know what they're doing in public health, and I'm just very impressed with them. I was a public health county physician for 15 or 20 years, and I really did not know how much work they did and what all they did. So I would dedicate this talk to the unsung heroes who happen to be the people doing the hard work right now, okay? Nate Smith, and I can't remember most of their names, but just wonderful, wonderful people. I thank you very much for listening to me, and I know I talked too long. I apologize, but I always do that. So thank you.
do have time for a couple questions. If you raise your hand, we'll get a microphone to you. Bob, right behind you.
Dr. Taggart, what impact do you think the Affordable Care Act and the private option will have on health in Arkansas?
I have only one problem with the Affordable Care Act. It didn't go far enough. It just didn't go far enough, okay? We need to include when I went to medical school, I heard a debate in 1969. And the debate was, it was a bunch of doctors, by the way, okay? Was health care a right or a privilege? The population of the United States, the vast majority of the population of the United States has decided that health care is a right and not a privilege, okay? And I think the quicker we get to it, and the only way I know of to do this, and this is my CW Garrison coming out in me, okay, is to take the profit and molding it out of medicine. Find a way to do it out of pharmacy, out of medicine, out of medical equipment, okay? And I know it's been tried. I don't know. Do I think it'll help? I think if you can see, I put several slides up there that says social contract changes. Social contract changes. I think the social contract is changing, and it will eventually get where it needs to be. I'm sorry, I may not have answered your question adequately.
Anyone else? Well, thank you all for coming out on
Thank you
this
very much.
beautiful day.